Hello everyone and welcome to NEET Mentor. In this session we will talk about how to choose a branch for the PG course. The counseling may start in 2 or 3 weeks. So this is the right time when you should sort out your preferred branch options. It is other thing that based on the rank you will either get it some branch easily or not easily, okay? But you should have very much clarity in your mind that which branch is suitable for you. I'll tell you the some tips like how you can choose the branch and not regret in the future. We'll tell you the pros and cons of all the mostly clinical branches, and hopefully this video will be useful to you. If you are here new, please do subscribe our channel. You can avail our paid counseling guidance packages. Under our paid counseling guidance, how we help, we add you in a group where you receive all the notifications without any miss. We provide you the probability analysis report, which considers all the institutes with the details, fee structure, and hidden details, and the good institutes will be marked in that. Then you will have like which registration you should consider, and then you can talk to us, our team member, one to one. There is no group conversation, it's always one to one. For all the counseling wise rules and other details, the information will be shared, and the choice filling will be prepared for you. As you know, we get seat matrix and all those things, and you can always discuss the strategy for the upcoming rounds, how to upgrade. If you have joined like multiple counselings, participating in multiple open state counseling, or like your own state counseling or MCC counseling, then how to save your security deposit. So many things are very important. One discussion might give you like very good clinical seat, or like you will take the every seat. The counseling is all about getting the best possible in your all the possibilities, all the criterias, like which branches you want, how much is your rank, in which states you want, and how much is your budget, inclusive of all these factors, how to get the best possible seat. So that's all over the counseling. Getting something out of the counseling is not the best counseling, because you have put hard work of years, and then you have got particular rank. Now this is the time to get the reap the fruit from the hard work. Okay, if you do mistakes or don't do it in very serious mode, the counseling process, you will result in some seeds, but it won't be like best seed. Okay, at the same time taking the calculative risk on all things is very important. Coming to the branch selection, see, branch selection is also known as kind of like marriage. Okay, because with this branch you are going to spend your entire life, and this profession of medical, okay, requires your dedication, your passion, and your sacrifice, and you will have a great feeling that you are serving nation, serving the human, serving the mankind, and serving the world. That's why doctors are known as like second god. Okay, if they really behave so, they are to be worshipped. Okay, we have seen in the corona period and emergency period, doctors are the most required resources in our country, and still we need more doctors in our country. So how much valuable asset you are for the country, and in order to become that valuable asset, and you need to have the dedication, passion, you should choose the right branch, okay, where you fit comfortably. I have many stories from the candidates. They selected particular branch because they got influenced by their friends, colleagues, and whomever they completed the internship with. Okay, they got so much influence for particular branch, but later they came back after a couple of months, said that, you know, I have changed in decision of my branch. Why? Because I went through the practice. Okay, I joined a job, okay, in the same branch where I wanted to work, just to get exposure, like how is the work life, how is the life there, and how I am suitable. They realized that, okay, it's not made for me, because I can't handle that much hectic schedule. Those things are not suitable to me. So you should not just get influenced by other people, how they are selecting the branches which is in more demand. Rather, you should go ahead and pick all the factors, okay, which decides like which branch is suitable to you. So that's what I'm going to discuss in this video. It will be little lengthy, but a bit useful to you also. So these are the clinical branches. Starting with the radio diagnosis. Okay, radio diagnosis, as you know, is it's highest demanding branch right now. The demand is highest. Okay, how I can say highest? You see, like top 1,000 candidates, top 1,000 rankers, how many will go for uh, radio diagnosis? Okay, that will tell you like demand. So why is this demand? There are many pros and there are cons also. Okay, but if you are matching, if you are relating with the pros, then you can go for it. At the same time, you should see how comfortably you are able to get this branch. If you are not comfortably able to get this branch, then you should choose similar kind of alternative which will get you same kind of luxury in the life. Like you will have good amount of money. Okay, second thing, the work duration, okay, is kind of fixed, so less stress will be there. Okay, as a doctor you will definitely have to take stress, but calculative and limited stress. In case you want to put the effort, stress will definitely come, but limited stress you will come across. Work life balance is good. Okay, because you will have like a fixed work hour. This is kind of end branch. After that, you can go for interventional radiology, super specialty. But there is one option. Even you don't go for it, no, then also is okay. Uh, then you have very minimal patient interaction or no patient interaction. Okay, so if you don't like patient interaction or that much workload, OPD, and listening to the problems of patients, interacting with the patient, this is a very, very good option, and it has good reputation also. Okay, you can run your diagnostic center and you can earn a lot. Okay, now the cons of it. Publicly, at the social level, you will have less recognition because the patients are not interacting to us, to you. Okay, it's a kind of like a sidewise branch. Okay, where the patient interaction is not happening. So if you want, like, want to get the feeling, then this is not the right branch for you. You should go for medicine or surgery and go for super specialty. Then you will become kind of like one in a lakhs. Okay, that kind of person as a doctor. The setup, if you want to go for the setup, your own setup, it will be more expensive. So initially you need to rely on job and working in corporate hospitals, all those things. See, one thing is artificial intelligence. AI is rapidly growing, and it's impacting all the different areas wherever we live. Okay, we are also surrounded by AI somewhere, using Chat GPT, using some machines, and these tools are also having AI inbuilt. Okay, so in future, some of the procedures, some of the diagnosis might be replaced, but if you feel so, after 10 years down the line, you can go for the super specialty option, interventional radiology. No patient interaction. If you want patient interaction, then this is the problem with this branch, but overall it's a very chilled branch. Okay, you won't have to like pay so much of attention or like to the patients, and work life balance will be good, and good amount of money also. So that's why it's highest demand. Next, which is highest in demand, is general medicine, because general medicine is very core branch and it has a lot of opportunities. Okay, uh, there will be saturation in some years. Okay, in general medicine, if you just complete a general medicine MD, but after that you have a lot of opportunities to go for DM. Okay, so it's evergreen branch. Demand will never reduce, and it will have like good reputation. Okay, if you become neurologist, cardiologist. Okay, good reputation, good amount of money also. There is no end, there is no limit. Okay, sky has no limit. Great opportunity, job opportunities are still very good. Okay, and rewarding. The starting job will also be like highly paid. Negative point of it, like you need to go for super specialty. You will realize that after a few years you need to go for super specialty, because you'll feel that the growth is not that much. So you can go for super specialty. Workload, yeah, you need to be ready with that mindset that you have to put big effort, and you should be passionate for this branch. It's not like very relaxing. Okay, you need to handle the emergencies also, more patient interaction, and after patient interaction again you will get follow-up call. Those things will be there. Stress will definitely be there, but it's not that great also. Little bit challenges of if you don't match, if your personality, if your desire, if your expectation not matching with the expectation of this branch, then it might be challenging for you, but it's a great option. I'll say is the better than radio diagnosis also in some of the cases. Pediatrics, now third comes pediatrics. Okay, in case you want to go for general medicine and you are not able to get it, go for pediatrics, because it will have all the super specialty options after completing. Okay, for what options you have in general medicine, and it's a end branch relatively. After that, what I feel like, okay, you can go for neonatology. Okay, that's also very good super specialty option. No setup required, just you need to have like kind of office setup, and you can start your OPD, you can start your clinic, and it will be good rewarding also. But you need to evergreen branch also, good job opportunity, money is also good. Now coming to the negative point, okay, many people won't be able to handle kids and all. Okay, so you need to be comfortable in all those things. Okay, then only choose this branch. If you're not very comfortable in handling kids, okay, because they don't communicate. Okay, so you need to understand, I need to handle with, and some of the cases you will face like, okay, uh, because their parents will be so much worried. Okay, and if something happens, okay, so that's kind of fear is also there. The competition is also increasing. Okay, so you can go for super specialty, and recognition is still there, but it's not as comparable with general medicine. Okay, so you will earn more money, but you have to put a lot of effort also. Coming to dermatology, dermatology is a branch, okay, which is high in demand due to few things that got introduced in few last few years. Okay, due to surgery, due to like cosmetics things added to it. Okay, if you just want to go for like skin diseases, then it won't be like that much demanding. Okay, so it's also like radio diagnosis, it won't have emergencies, good amount of money also, and it's end branch. Okay, so after that, no study, no emergencies, less stress, and good reputation also you can earn, but it takes time. Some I have heard from the doctors also, experienced doctors who are like 50 60 years old. They say that you need to like stay for like around 10 years. Okay, to make it full-fledged setup, and get the awareness among the people, and it will take that much time. Okay, so you need to have patience. Less number of seats are still there, so getting seat is difficult. If you have less score, it will be so much costly option. Next, general surgery. So general surgery and general medicine, these two are the very core branches. Okay, after that you will have lot of options in super specialty. Okay, so if you dream to go for the surgery, go for it. Okay, it will have good money after super specialty. Just after completion of MS, it won't be that rewarding. Okay, and there is a lot of saturation also. It's also evergreen branch. Okay, but you must consider going for MCH super specialty. Job opportunities are there, and good money also there. The thing that you should keep in mind, you should go for the super specialty, or directly you go for the 6 years DNB integrated course, so that you don't need to appear for the NEET SS examination again. The competition will be there. Okay, and this job requires handling a lot of emergencies. Okay, but good thing is like, okay, if you don't want to keep studying, you do the surgery and leave the OT. Okay, so this kind of branch it is. Okay, so you just go complete your work and leave it, then you will have some follow-up calls that you can handle. But medicine will be kind of like, okay, you need to be with all this setup for your entire life. Surgery is not kind of that branch. Okay, some risk filled cases will be there. Okay, so some threats and fear will be there from the public. Okay, something happens in emergency, it will be more a responsible job. You need to be more focused if you are able to do, if you are able to focus, okay, and like this branch, just in order to get the exposure, join somewhere, okay, for 1 month or 2 months, you will get the idea. Because I have the cases where the candidate joined surgery in private setup, MS general surgery in a private medical college. He spent around 30 lakhs in the first year, but after like 1 month or so, he said that okay, no, I can't survive with this branch, these all things I don't like. So no matter it's very like immature thing that you get attracted to particular branch without knowing the pros and cons and getting reviews from the seniors. So this is right time for you to choose the branch, do all the research, okay, it will pay you off, okay, later you won't regret. So don't go for particular option due to demand, okay, just see like okay whether it's suitable for you. That's why in the internship period you are given opportunity to live your life with the different branch setup and option, so that you can get some exposure. Accordingly you can choose the branch. Many candidates do not have any idea like okay which branch is suitable for me and all. So that's a kind of like very bad state. You need to get out of it, okay. Have very much surety, this is my branch 1, branch 2, branch 3, at least 3 branches you need to have. Setup is also expensive in this branch. Now coming to OBGY is again a very evergreen branch, and the demand was already there, and demand I saw in last 2-3 years it has again gone up, okay. So good amount of money, okay, good recognition. It is combination of medicine and surgery also, okay. Not many surgeries you need to know, okay, 6-7 surgeries, if you know then you can live your life with it. But it requires like okay high emergency, there is no day, there is no night for those people who choose this branch. And it's very sensitive case, but if you have got like very good hands on, then it's like very easy for you also. But you should be ready for the emergency duties and emergency handling, emergency high workload. It's one of the most hectic branch, I would say, as per the review from the doctors, okay. But it's very good if you are ready to live that life, have busy life. You should be energetic all the time and ready to handle all the cases. Orthopedics is a very good branch, but now little bit kind of like saturation is there, okay. And that's also kind of end branch only. Some options will be there in the super specialty. I'll put a separate video what options you have in the super specialty, all with the proper document reference, because we do super specialty counseling also. You can watch our videos like 1 or 2 months back, we added like few super specialty videos. It has good amount, you can run your own hospital, and you can earn a lot. Emergency will be less, okay, but it's more suitable for because it requires physical strength, more suitable for the male candidates, okay. Good reputation also, and the demand will still be there, okay. Situation is there, okay, but still if you are good out of it, okay, you can make a name and fame. Saturation, I said, more competition, physical demanding, and patient satisfaction is there, okay, because you feel and realize. Now coming to ENT. ENT maybe not be the first option. It kind of like backup option as people see it, okay. It's also relatively end branch, but if you feel that okay you're not able to get that much money, you can go for the super specialty. Many surgical super specialty options are available in that. Less emergencies, okay, because the surgery won't be major, minor surgeries will be there, and you can have comfortable schedule, fixed schedule, work life balance will be there, less stress, okay. It also has like less repetition, because among like popular doctor you won't find any ENT specialist, okay. Rewarding will also be less, but if you don't like all the name and fame and interaction with all world, popularity, social media, you don't want to get in all those things, this is a good branch, and you can go for the super specialty also. But it is more or less considered as like backup option of surgery or like other surgical branches. Coming to the ophthalmology, okay, ophthalmology used to be like very good branch some time back, okay. Now it has saturation, and due to some government policies also, many cases are going for to the government setup. Okay, so it's also end branch. Okay, it has good money, but in order to have your own setup, you need to invest so much. Okay, and the corporate hospitals are more and more in ophthalmology. That's why your own setup may not be able to survive if you are really good at it and you have managed properly. It also gives less emergency, less stress. The work-life balance is comfortable. Mainly, it will be opted by the female candidate because they need more time at their family, and situation is still there. Okay, setup is expensive. More competition is there because more corporate hospitals are open in ophthalmology. Recognition is also there, but it's not as much as in general surgery, option gynae, and general medicine. Okay, so it's one of the good option. Okay, but you need to have like good hands-on and all those things. Anesthesia is very unique branch, because what I'll say, you won't get the feeling like doctor. Okay, and if you don't want to get feeling like that, you want to have like leisure life. Okay, then fixed time, and if you want to work less, you can work less. If you want to work more and more, you can do that. Like, okay, how much effort you put, it is proportional to the amount that you are going to earn. Okay, it will have the scope always. Okay, because it's not a replaceable branch also. Decent amount money also, and no setup required, nothing, zero setup. Okay, just you are the only setup. The doctor himself is a setup. Okay, so you will like just complete your work, and then no backlog, nobody will call you, nothing. And the council, like, okay, you will be handling only emergencies, OTs, critical care. And after anesthesia, good thing that many people are going for the critical care. Okay, and there are a lot of seats available in DNB critical care, lot of seats. uh, as a recognition, you will have like almost nil recognition among the society, and growth is also there. Okay, but it depends on how much effort you put. Okay, if you after some time you feel that okay, growth is limited and it's got stagnant, then you can go for critical care. It's also good option because getting seat in anesthesia is much easier than any other branches, because a lot of seats are there, the maximum number of seats in medicine, surgery, and anesthesia, these branches. But you will have dependency, but over the time of period you will sort out these dependencies. You will have like link with good hospitals, surgeons, so you will keep on getting the cases. Coming to respiratory medicine also I feel like a good option. In case you are not able to go for general medicine, you can consider it as an alternative. It's also end branch. Okay, and the emergencies are not as high as general medicine. Okay, it's emerging branch also, and after the corona period it has got like higher demand. Job satisfaction, you can run your OPD also. Many things you can do which you can do in general medicine. The money, it's a decent amount, not very high also and not low. Okay, no personal setup required. Okay, and the recognition will be less because you will be handling with limited cases and procedures. Limited growth also, work at hospital only is option, but you can run your own OPD also. Psychiatric medicine, okay, it again had kind of like up and down tides. There was a time when it was like very much in demand, then demand reduced. Now the demand is further increasing because we have a lot of stress and all the mental illness due to our lifestyle, westernization, all those things. So more patients are there, particularly in the metro cities. You will have like and it's very easy also and very tough also in some terms. Okay, because you will keep on like regulating on the similar medicine, and same patient will keep on visiting after regular interval. So once you have the patient based in your OPD or in your setup, okay, then it is very easy going branch. Okay, very cool, and work life balance is good, and good demand in metro, right, definitely. And it's emerging branch also, the demand will keep on increasing, but less number of seats you have for this branch. You need to have more patience. Okay, because you need to handle with the people who are not 100% up to the mark as per the census, and you need to have a lot of patience in understanding. If you are not able to show that much patience, okay, this is not the right branch for you. You might feel like you yourself are depressed after some time. Okay, sometimes boring also, and some emergency cases will be like difficult to handle. Okay, but that those are rare. Radiotherapy is also kind of like emerging branch, and some situation also, because the scope is not that great. Okay, limited scope, and you can go for the research, you can go for the cancer hospital, and you are eligible for a super specialty like DMA, medical oncology. It's also rewarding. Okay, but you will have like self satisfaction that you have treated someone who was struggling so much with life. Okay, also that there's self satisfaction will be there. uh, the cons is like, okay, because your setup will be like so different. It might be like sometime depressing, and you will feel sad also, because you will be in the negative setup, not in very positive setup. The income will can be like a problem after some time, because it is not that much, because you have to depend on the job only. You can't have your own setup. Okay, but you can manage like multiple centers. Family medicine is a kind of branch which is mix of like multiple branches. Okay, it is made for the government centers or government policies related to rural areas. Okay, they need doctors where they have experience and exposure of multiple branches. Okay, so good for rural areas. Okay, and better than being just MBBS. Okay, if you have your own OPD, then you can after time, if you like really focus on it, and you are like able to give the satisfaction to the patients. Okay, you will have like decent amount. OPD is a good option. There is no super specialty specifically. Okay, job issue will be there, because in the metro cities it is less considered, because there are already many doctors who are in the mainstream, so they will less consider family medicine. Okay, emergency medicine is also very good option nowadays. Okay, you do anesthesia plus critical care is equivalent to emergency medicine. And if you are not able to get medicine or respiratory medicine, I suggest you go for the emergency medicine. Here also you need to actually it will be much more like you have to spend all the time in emergencies, but it's equivalent to critical care. Okay, you can run the emergency setup on your own. You can have good amount of money also. It's a backup of medicine branch, but always you need to deal with the emergencies. Okay, I won't say that so much saturation has come. Still, the scope is increasing, and no OPD. You need to work in like emergency setup only. The OPD option is not there. So emergencies and uh, emergency is a kind of like just negative point. If you are able to handle that, tackle that, then it's a good option. Okay, so almost all the branches I have covered. Okay, so I think if you like this video, please press like button, share with others, and subscribe our channel. And you can call us on this number for any kind of paid assistance and our to avail our packages. That's all. Thanks for watching.